morning. I'm Martin Grobusch. I'm the chair of Tropical Medicine and Travel Medicine here at the University of Amsterdam. And I was asked to address the topic of vaccines for pregnant women and for younger children. And in essence, actually, there are a couple of things we need to consider. If we start with the pregnant women, actually, it always comes down to a risk-benefit ratio assessment. At the beginning, we have to ask ourselves if there is a pregnant traveler addressing us, asking us about risks. We need to be aware that there might be situations where we have to discourage our aspiring traveler to travel, and very often if we discuss real risks, there are some travelers who would say, oh, I didn't know that, actually I won't be traveling, then I'd rather postpone this. Now, for all of those who have to travel, it's important to know that live vaccines, and yellow fever is one of the most important in this series, should not be administered during the first to the third trimester and not to women who are breastfeeding, because there is a theoretical risk that, and a very low real risk, although we lack for good reason data on this, that if you administer a live attenuated live vaccine, actually that the pregnant woman might get viremia, and there might be transmission to the child. That doesn't mean necessarily that the child would fall ill, but for that reason we would refrain from doing this. There are all other vaccines, polysaccharide vaccines, killed vaccines, immunoglobulins, which might have to be administered after a query, suspected rabies, they are perfectly safe. Still, for good reason, there are no good clinical trials. So we rely on anecdotal data and our theoretical knowledge to assume that, in principle, most vaccines are safe during pregnancy. Recommended vaccines are a booster for DTP, actually, that's very important. Influenza, seasonal influenza, not the live, but the attenuated vaccine is highly recommendable. And we know that these vaccines also spill over. They provide protection for the unborn. If it comes to the traveling young child, actually, it's important to know that the immune system of young children has still not matured. So we see immune response which is more shifted towards the Th2 response, which means that the humoral response is not as mature as at older age, which means that polysaccharide vaccines are to no effect administered. But what is important is there are a couple of vaccines such as Hepatitis B Vaccine, and in low and middle income countries, the Bcg Vaccine, they are highly efficacious and very worthwhile to be given right after birth. And with all other vaccines, again, common sense applies. There are very elaborate guidelines which are more or less identical all over the world. When best to administer antigens for the first time, how you have to space them with regard to other concomitant vaccines, and to that end, both women and young children could travel happily. Thank you.